Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Phases of acute kidney injury. In acute kidney injury, we have two phases. One, we have oliguria is present. Second, we have polyuria is seen. So first we will see the phase of oliguria. So in the phase of oliguria, you will see that the following clinical features are present in the phase of oliguria, and we will see the treatment also simultaneously. So if the patient has intravascular volume overload, okay, because in the beginning, because of the kidney injury, the kidney cannot absorb the there is cannot filter. First of all, the kidney cannot filter the glomeruli properly, so as a result urine formation is less, which results in intravascular volume overload. When there is intravascular volume overload, because of increased volume overload, the sodium concentration will be relatively less when compared to the high volume, so there is relatively hyponatremia is seen in these patients. Then the patient may also have hyperkalemia is seen in the patients, and then because there is no excretion of potassium is lost, so there is hyperkalemia. Excretion of H plus which occurs is also gone, and also one important thing is kidney is important buffer mechanism in our body. So because of that, the buffering capacity of kidney is lost, so this will result in metabolic acidosis in the patient. The patient can also have hyperphosphatemia can occur, and there can be hypocalcemia, or the patient can have hypermagnesemia where there is increased concentrations of magnesium are seen. There can be hyperuricemia is seen, and nutrition deficiency can occur in the patient with oliguria, in the phase of oliguria. So these are the different things that are seen in oliguria.
thank you and thank you for watching.